Immunotherapy obviously has changed the scheme of medicine, and we're only in the infancy of it. Their broad use has picked up dramatically over a couple of months practically in the world, and especially in the United States, and now they moved into the frontline therapy. As we combine these drugs, now we're looking at studies combining immunotherapies with second-generation agents and just second and third-generation agents by itself. Their use is going to be even more broad going forward. So they're here to stay, obviously, probably going to get even more broadly used over time, and it's going to hit a lot of patients going forward. These drugs are very unique compared to other drugs that oncologists are used to giving. So many are not used to management of the side effects and toxicities. So we're going to be talking about how to manage those, what to expect, how to get staff involved, and really focus on practical aspects for practicing clinicians, given how broadly these are going to be used. The side effects that we're going to be dealing with are immune-related complications such as GI side effects, diarrhea, pulmonary complications, endocrine complications, all of which are very different than the typical oncology side effects that we're used to dealing with. Oncologists are used to dealing with cytopenias, mucositis, things related to chemotherapy. With targeted therapies, we're used to dealing with rashes and other targeted side effects. These are very unique and just different in terms of what people are seeing. They can happen at any point during a patient's course. They can happen in very bizarre fashion sometimes. And clinicians and nurses and staff can be very late to realize what those things are. And what happens is, unless you really are aware of them, patients can get into trouble. The hope is to try and make sure physicians really understand what they're dealing with so they know how to deal with these expeditiously. So a lot of the drugs that we use to manage these are steroids and other anti-inflammatories. I think the biggest focus has to be on patient and physician and nurse education. What ends up happening is if your staff isn't aware or knows to ask the right questions or understands what the complications are or the ramifications are of those, patients can get into trouble. So we're trying to focus on education and identification sooner rather than later.